It's been 24 minutes. It's time to call the code.
No! This is my code. You gave me this code.
That's enough.
No, move. We got a pulse.
Her end tidal CO2 is less than 15 for the entire code. That doesn't necessarily mean that... Yes, it does. She's been without oxygen to her brain for 26 minutes. Congratulations, you got her heart beating again, but she's brain dead.
So if you haven't seen my last video about them running a code blue, they actually do a couple things right. They start at chest compressions, they check for rhythm to determine if it's shockable, but Conrad's last statement, that because her end tidal CO2 is low, does not necessarily mean that she is brain dead. In fact, there is a whole set of criteria that need to be fulfilled to diagnose brain death, including a thorough neuro exam and an apnea test in the ICU. So what is end tidal CO2? It is a number that tells us how much blood is moving through the body during CPR by measuring the carbon dioxide being breathed out. It reflects carbon dioxide seen during chest compressions, pulmonary blood flow, and tells us the likelihood of the patient having ROSC, or return of spontaneous circulation. So does end tidal CO2 being less than 15 for 20 or more minutes during CPR mean anoxic brain injury? No, not necessarily, but it does mean a poor prognostic sign. Persistently low end tidal CO2 of less than 10 to 15 is associated with poor perfusion and a low likelihood of ROSC. But end tidal CO2 alone does not confirm anoxic brain injury. This is where Conrad gets it wrong. Very low end tidal CO2 not only indicates poor chest compressions and low pulmonary blood flow, but it can also be due to severe acidosis, prolonged downtime of the patient, possibly a massive PE or pulmonary emboli, or other obstructive causes, and possibly hypovolemia. To remedy low end tidal CO2 during a code, do chest compressions at a rate of about 100 to 120 beats per minute, CPR at a depth of 5 to 6 centimeters, and you should feel the full recoil with possible ribs cracking during CPR. Make sure to also check the endotracheal tube and its placement to make sure it's in the correct place. During a code, it is also important to check for reversible causes such as tension pneumothorax, cardiac tamponade, pulmonary emboli, hypovolemia, severe metabolic acidosis. And remember, if the end tidal CO2 rises suddenly, like jumps to 35 to 45, that indicates usually a return to spontaneous circulation or ROSC.